Interestingly enough, you guys offer pregnancy massages.
Yes, we do. And
what are they?
They are fantastic, is what they are.
You've been told.
I've been told by my wife, who through both of our children received pregnancy massage throughout every month during her pregnancy. And really, what it's designed to do is allow the body to stay in shape for the big day. When the big day comes, those muscles need to be prepared to do a lot of work, and oftentimes throughout the span of the pregnancy, those muscles are being taxed and pulled and pressed in all different directions, and when the big day comes, they're too tired to perform. A pregnancy massage keeps you prepared and ready for the big day.
And how often do pregnant women come in for pregnancy massage? Is it something that you do, or you would encourage moms to be doing for a couple of months beforehand?
Yeah, I mean, oftentimes the patients that are coming in were patients before they got pregnant. Now they're coming in for a different type of massage, the pregnancy massage. So they start coming in, once a week, every couple of weeks for their pregnancy massage. And as their bellies get bigger, they certainly can't lay on them. So we have special pillows that are designed for side lying position, but they can also lay down on their stomachs, where these bolsters can allow their bellies some room to move.
How old is massage?
Thousands and thousands of years old.
You've got to think that, right?
It's old. It's one of the oldest medicines that are out there. Okay.
As technology increases our knowledge of the body, has massage changed?
Absolutely. I mean, there's research being done today about how massage can affect the human body, how the massage can affect simple collagen rebuilding or fibroblast activity during a massage treatment to recover from an injury. So the research is always being done out there, and we're still learning more and more benefits of massage.
How many muscles in the body, Drew?
How many muscles? Well, I guess the answer would be it depends. Depends who you ask. There's anywhere from 650 to 850 muscles in the body.
Do you have to know them all, or a lot of them?
You should know 95% of them.
Do they work independently or in concert with other muscles?
Both. Some muscles can work independently depending upon the action that's being performed, but more often than not, when a muscle's going through a range of motion, there are other muscles that are being used as stabilizers that are working in concert with those muscles.
I get, because I'm sitting in this chair, to ask the kind of questions that most people would like to ask but are going to be embarrassed to ask because sometimes they sound sort of dumb.
I don't know if I like where this is going.
I'm just gonna do that. How and where are muscles attached to our skeletons?
Excellent question, actually. You've probably heard of tendons and you've heard of ligaments, okay? Tendons attach muscles to bone. Okay, ligaments attach bone to bone. So typically what happens when somebody hurts themselves, the injury usually occurs at the tendinous muscular attachment. Okay, it's where the muscle fuses into that tendon before it attaches to the bone. So that's really what we need to focus on when somebody comes in with a strain. It usually happens in tendinous junction.
So those are places where the muscles attach to the skeleton through tendons and ligaments. Those are areas that you, as clinical massage therapists, would pay a special attention to.
Very much so, yeah. I mean, you have to focus on where that happens because most injuries will occur at the tendinous junction of the muscle and not necessarily at the belly, but then obviously over time, through repetitive use, breakdown of the tissue occurs.
What causes muscles to knot up or tighten up? Posture?
I was going to say it's overuse activity, and overuse activity doesn't mean you need to be movement at the time. You're sitting here in a chair right now. Your hip flexors as you're sitting here right now are shortening and they're getting tightened up. So you're creating some problems in that if you don't get up every so often and stretch those muscles, you can create some problems.
So we have posture, I'm sure stress.
Stress, we produce chemicals.
Injury, repetitive activities.
Yeah, we've all heard of carpal tunnel. It's like the buzzword that's out there, right?
The human body was not designed to walk on concrete or sit in front of a computer all day.
It was not.
So what you're seeing is with the clients who come into your office is the result of modern living.
Yes. That's why we always joke that we're recession-proof, because life still happens outside of our doors, but it's up to us as therapists to understand how life happens.
Does the body compensate in ways that both mask and exacerbate the problem?
Typically, when somebody comes in and they say they're feeling pain, it's because their body has basically broken down to the point where now it's asking for outside assistance. The body can do a great job in repairing itself, but when the body starts sending up pain signals, it means that the body's saying, okay, I can't do anymore, give me help.
So muscles cannot knot up without individuals being especially aware of it?
Absolutely, they can. They can knot up for just bad sleep posture.
And knots can turn into something worse.
Knots can develop into, they can almost calcify, and they can become adhesions, so you can feel them, where you press on somebody's shoulders and they feel a little nodule in there. Can the clinical massage therapist break up that tissue? Absolutely they can. It's not going to happen overnight in one treatment, but that's typically what happens when a muscle becomes shortened.
So hence we have shoulder aches.
Yes.
Back aches.
Yep.
Neck aches.
They're all compensatory patterns that occur.
Arm aches.
Yep.
I'm describing my situation.
Yeah.
So it's time, basically, to get serious, and time for a serious massage.
Yeah. So basically, what we say with clinical massages is we need to make sure that people are doing it on a preventative basis. We want people to be more proactive than reactive with their health care. So typically, when people do come in, they're saying, "I'm in pain. I need help now." Our job is to kind of get them out of that pain and then teach them how to be more proactive in the future so that pain doesn't creep back up on them
And
again.
what you guys try to do is, if folks come to you because they're in pain, is you try to get them out of pain and then try to encourage them to come back and see you on a semi-regular basis in order to avoid being
the reoccurrence of the injuries, of course.
It's not unlike bringing your car in for an oil change.
Right? We take better care of our equipment in our lives than we do of our own bodies.
What does one need to study for a degree in massage therapy?
Well, this is a touchy subject with me. We have some great schools in the area here that the students will go for anywhere from a 9-month to a 1-year program. But there are other schools in the area that you don't have to go as long. So the criteria is fairly basic for what they need to do to learn your Swedish massage. But to learn the more specific techniques with the clinical massage, there's a ton of great educators that are out there in the circuit right now that teach continuing ed units to allow them to further their education.
You guys over at Boston Bodyworker in Copley Square are certified by the National Certification Board for Therapeutic Massage and Bodywork.
That is correct.
What is that? And how difficult is it to get that certification?
Basically, what the National Board is, National Board sets a standard that states that massage therapists need to maintain a level of excellence once they complete their schooling, and that means that they have to take continuing ed classes to further their education in their specific field of massage therapy. But really what happens is when you graduate from massage school, they prepare you to take that national certification exam. So I recommend the students, if you're listening, to take that exam as soon as you get out of school, because the further you get away from that school, the more difficult that exam can become. But of course, there are study guides to help you get through it.
And again, it's the National Certification Board for Therapeutic Massage and Bodywork, and indeed